According to the Centers for Disease Control, 1 in 68 children on the autism spectrum is on the autism spectrum. Joining us this morning is Dr. Kowal, an IU health physician who specializes in child and adolescent psychiatry. Thank you so much for joining us this morning.
Thank you, Krista. It's great to be here.
Well, April, it is the last day of April, but it is Autism Awareness Month. Let's start out by talking a little bit about just how broad the spectrum really is.
Yeah, I think that a lot of people don't realize how broad the autism spectrum is. I mean, it's called a spectrum because there's a variety of kids who fit into it. And so some of those kids can range from being above average intelligence, very intelligent kids, to kids who have intellectual disabilities and have more learning problems. There are also kids who have, great verbal skills and abilities and no speech delays. And then there are kids who are nonverbal on the spectrum as well.
Let's talk a little bit about, talking of this broad spectrum, just kind of some of the characteristics that set children with autism apart from other children.
Yeah, I think that's a good question because they do have, all of the kids who are on the spectrum have certain things in common. And so the ways that we make a diagnosis for autism is based on social communication difficulties. These kids have difficulties with peer interactions, developing friendships, having a back and forth conversation with someone, reading social cues, verbal and nonverbal communication, as well as restricted interests and repetitive behaviors.
I think so often people have this misconception of what autism really is. How important do you think it is to raise awareness?
I think it's extremely important to raise awareness for diagnosis of autism. We know, based on many studies, that early diagnosis can improve outcomes for these kids. So there's a huge effort and a huge push across the nation to try and get kids diagnosed early so that they can get the services that they need.
And just talk a little bit about, briefly, about the resources in our community available.
Yeah, so I think in our community there are a lot of great resources. I think that one of the things that I wanted to mention is that IU Health Arnett has, in collaboration with Purdue University and the IU School of Medicine, has started an early evaluation clinic to try to diagnose those kids between 18 and 42 months when we know that's the critical period. And so, we have the ability to have referrals in from our pediatricians and primary care providers with the hope of expanding that to the community at some point.
All right, Dr. Elizabeth Kowal with IU Health, thank you so much for joining us this morning.
Thank you.